All right. So what are you up to these days?
Personally or professionally?
Either. Both.
Yeah. No, I mean the summertime as a sports medicine physician is generally speaking relatively benign.
Mm.
The sports don't happen as much, although it is the Olympics this year. But my basketball team I take care of is we have our draft at the end of the year, at end of the month, but there's not much else
Ooh,
besides that. And
okay.
then so we have some workouts going on for players that occasionally I have to do something about. Our baseball team that I have to go to games from time to time, and we don't win many of them. Although I will say I'm 5-1 as a covering physician this year for a team that has 19 total wins. So I'm bringing some good juice, I think, for whatever reason.
That's so fun.
Yeah, and otherwise I see patients. I don't have a lot else going on. I mean, fall's the worst month to talk to a sports medicine doctor because that's when all the sports really rep up, and including football. So summertime's good. And then personally, my kids just finished school. They started camp this week, and we got some trips scheduled. And I don't know. It's summertime in Chicago. We have to pack like a whole year's worth of fun in 3 months.
Absolutely. Totally. All right. Well, that sounds like a great time. Let's quickly scroll through and see where some people are coming in from. So we've got Connecticut, Beaumont, Chicago. All right. Omaha, Ohio, San Antonio. Got some questions already. This will be fun. Pittsburgh. Okay. Maryland. Great. Okay. Fantastic. Toronto. Atlanta. Okay. Fabulous. All right. So, Jeremy, should we get started?
Let's do it.
All right. Let's do this. Okay. All right. Thank you all for joining us. We are going to just advance these slides. Actually, we'll start over here. All right. So, today, it seems like every other wellness ad these days is about a recovery trick or product. But what does recovery even mean, and why does it matter? You will learn what's really behind recovery and how it can unlock your best performance and keep you away from the doctor. And that's why we have our special guest, Dr. Jeremy Alland. And Dr. Alland, let me make it so we can all see him. Okay.
Here I am.
Dr. Alland is a sports medicine physician at Midwest Orthopedics at Rush in Chicago, Illinois. He serves as a team physician for the Chicago Bulls, the Chicago White Sox, Chicago Dogs, and Mount Carmel High School. Dr. Alland is an active researcher and has authored numerous papers on topics in sports medicine. He's a subcommittee chair in the AMSSM Research Committee. And he also serves on the editorial board for Sports Health. And he specializes in the care of the entire athlete with special interests in the throwing athlete, the golfing athlete, the sports performance, ultrasound guided procedures, and overall spreading the message that movement and exercise are the best medicines. He's the founder and co-host of Your Doctor Friends podcast, which aims to bring approachable, easy to understand, and evidence-based answers to the questions we all have for our doctor friends. So today, Dr. Alland will explain what's behind recovery and how it can unlock your best performance and keep you away from the doctor. All right. Welcome, Jeremy.
Thanks for having me. I'm excited to be here, and that was a really good intro. Thanks.
Awesome. Now, I wanted to do that before we get to the not as much fun stuff, which is really our usual disclaimer. This event is for general informational purposes only, does not constitute the practice of medicine nor the giving of medical advice. No doctor-patient relationship is or has been established, and the content on this webinar is no substitute for professional medical advice. Under no circumstances should any of this information be used to disregard or delay obtaining medical advice from your own physician or healthcare team. These events and the content presented is separate from and not endorsed by or a part of my work with Rush University. I am Naomi Parrella, and I'm the Chief Medical Officer at Zero. And so I'm here hosting our favorite sports med doctor, Dr. Jeremy Alland. And you will see here the QR code to be able to access his podcast, Your Doctor Friends podcast. Highly, highly recommend. He's got some really fun topics and some great doctors on there cracking it up with him and his co-host. All right, so Jeremy, I'm going to hand this over to you so
Yeah.
that you can go through. But before we get started, I just want to remind everybody the whole purpose of this is to get access to Dr. Alland. So he's going to do the presentation first, and then we've got already pre-submitted questions that have been sent in ahead of time, and we'll ask those after, as well as if you have questions, put them here in the chat. And we'll try to get to as many questions as possible after Jeremy shares with us some of his expertise in this space.
Cool.
All to you.
Ready? All right. So, when Naomi asked me to come on here as a usual doctor, I thought I had to make slides. So I made some slides because doctors make slides. But I will say that I advocated to continue with these because I think they're very quick, and I think they gave a really good outline of kind of what we're talking about here when we talk about recovery. And I think Naomi did a good job of reading that introduction. I think recovery is a buzzword. It's a marketing word. It's a word that leads to people using their money or trying to figure out how do I excel in this world of a nebulous recovery that people talk about on television and such. So the first and foremost, like, what even is recovery? So we'll define that. And then I want to introduce a few easy strategies for recovery. And then we can talk about some of the marketed recovery aids that are out there. And then again, the majority of this, I want to be question answer. You did mention the podcast. I've seen some questions coming in. There's already like 3 or 4 questions where we did full episodes on this stuff. So definitely check out that for more information afterward, because we've done a deep dive through that too. So, but let's get on with it. Let's go to the next slide. So I wanted to start with a question. I want you to hear the word recovery, and I want you to think of the first thing that pops into your head. And some of you may be thinking about like these boots that expand on your legs, and some people may be thinking about a nap, and other people may be thinking about a massage, and other people may be thinking about that vibrating gun that you kind of put up and down your whole body. But when I think of recovery, I think of the next slide. I think of this, and it seems like it's kind of an overwhelming slide, but in reality, this is something that gets presented to a lot of us as we're going through medical education, and it's really not that complicated. You can see that there's a ramp of progression where we're basically training up into this big middle part that says training threshold, and we hit this inflection point. You can see one curve goes up and a dotted line goes down, and this inflection point is really this area where we can adapt and we can improve, and we're going to see our training goals met, and we're going to be super happy, or we can fail to adapt and we can see significant decline in our performance, and actually in the worst case scenario get injured. And the real question is, how do we do this inflection point better? How do we know when we're at this inflection point? And that's what we're going to talk about a lot today. Go to the next slide. So I think the simplest way that I explain this in the office is to, everybody's usually familiar with their phones, and their phones usually have batteries in the upper right-hand corner, and the battery has a signal, whether it's full or empty. And so think about your battery. And so I'm going to use this to apply to a few situations here. So imagine on Monday you wake up and you want to exercise, and so you go for a really nice long run, and let's say you push yourself a little bit. Well, you've used your battery, and so I'm going to recover. I'm going to go to bed, but my battery is now in that orange level. So I wake up on Tuesday, which is the next slide, and my battery is now more full because I rested and recovered. But you can see it didn't go back to being completely full, right? Because my muscles and the energy that I used yesterday have not fully recovered. We all know what it feels like to wake up the next day after a good workout and say, wow, I'm really sore, or I feel like I really use those muscles. Well, but at the same time, in the back of our head, we hear our doctors or our friends or just our inner guilt telling us we need to exercise again. And so we go and do that run again. And so we can see we drain our battery further. And so then we go to bed again, and we wake up on Wednesday. And on Wednesday, we know that we're supposed to cross train. So we decide we're going to take that orange battery, and we're not going to run today, but we're going to go do a really like high intensity interval training class where we do some lunges and some squats. These guys look pretty happy doing it. And that's great. I love that they're doing some cross training. But again, we use those muscles, and so we drain that battery. Now we go to bed and our battery is empty. So what happens on Thursday? Well, on Thursday, we start with this red battery, which is not great, but I'm training for that half marathon. And if I don't stay on that program, I'm in trouble. Like, I need to make sure I'm doing that program. So I'm going to go do that training run. And now the unfortunate thing is we get to the empty battery while we're still running, and now I'm injured. And this is a very oversimplistic look at this. This is not how it actually happens. But if you look at it from a broad level, almost every story I see of somebody coming in with an overuse injury happens along this spectrum of basically not giving our body enough time to recover or recovering properly, which is why we're going to focus on that today. So back to this slide, we're going to focus on this inflection point. And if you look at the small font, the treatment for this inflection point says to reduce your training intensity and volume, rest and increase sleep, proper fueling, and encouragement. None of those say anything that was marketed to you on television, unfortunately. And so it's not to say that those things can't be helpful or they don't feel good. But again, this inflection point is not really going to be changed much by those. Go to the next slide. So in other words, we're going to talk about recovery. And so what does recovery mean? And we're going to give you some buzzwords that I think are important. And then we'll get right into the meat of the question and answer. So first and foremost, variety. So we mentioned already the runner who then did the cross training. I think that's great, but you have to remember that when you're doing high intensity interval training and running, that's using similar musculature. You're still breaking down the same muscles. My quads are unhappy from Tuesday, and now they're unhappy from Wednesday, and then they're unhappy on Thursday. So I'm a big fan of things like yoga or doing some sort of meditative exercise. I think there's wonderful ways to do non-impact, kind of lighter things. And even if your heart rate doesn't get up to 130, it can still be good exercise for your body and allow you to hit that point and actually see gains. Reduce training and intensity. The amount of times I have to convince people that by actually not training, you're improving your performance, it's impossible to wrap our heads around this. But most people have heard of a taper where people will train really hard and then for like the week before the race, they'll just won't train because they need their bodies to recover. We need to be tapering on a weekly basis. Every time you exercise, your body needs to recover, and we need to let that body recover before we stress it again. And so that's where the variety or the rest days or the mental focus days come in. And so by reducing your intensity, you actually do get stronger and fitter moving forward. Sleep. I mean, I'm sure, Naomi, I don't know if you've had a sleep person on, and if you haven't, you're probably going to talk to a sleep person, but for very good reasons, sleep is getting a lot of publicity these days. We all know we don't get enough of it, but even when we do go to bed at the right time, like, are we doing the right sleep habits to make sure we're getting the right amount of sleep? How about the stuff that we consume during the day and how it affects our sleep? Things like alcohol, things like marijuana, things like even the food we eat right before we go to bed, all the things that sometimes even the Zero app are focusing on. Like, sleep is super important for not just recovery, but our overall health. Nutrition. I think everybody on this talk is probably really focused on this because you're here at a Zero talk, which means that you are focused on your nutrition. But, I think one of the things that I try to tell people who are active is that food is fuel. So I don't want you avoiding food. In fact, food is really, really good. And without it, you're going to be at increased risk for energy. But think about what foods you're putting into your body and think about when you're having them and compare that to kind of when you're training and making sure that everything is kind of lining up with your overall goals. You certainly don't want to put in all the time and energy and sleep and exercise and all this stuff and then have a couple donuts after you're done. And your body's just not going to respond well to that. Although I do love donuts, just to throw that out there. And then encouragement and connection. I think this is the part that actually gets really forgotten about, but it's on that chart. It's a medical treatment, but human connection is such a huge part of our overall well-being. And if you look at longevity studies where people want to live the longest, connectivity and sharing connection with humans is actually more powerful than anything that we have. It's more powerful than doing the right things with your medicine. It's more powerful than eating right and sleeping well. I mean, there's some studies that say you'd rather be a smoker with friends than not be a non-smoker with no friends. Now, I'm not going to advocate smoking, but my point is that we need to make sure that not only through our training and our exercise and our recovery, that we're not doing it in isolation, that we're doing it either around people or in a way in which we can kind of lift each other up. So these are some of the things that are out there. I'm sure we're going to get a ton of questions on these, so I'm not going to go through all of them and talk about them individually right now. But certainly these all have roles, and I'm a big fan of almost everything on this list in terms of my own personal preferences. But again, I think one of the things that, and Naomi can probably speak pretty well to this too, but one of the things we see frequently in our doctor's offices is that people tend to get to these parts before they're doing the more pillar type parts well enough. You're not doing the sleep part well enough. You're not doing the exercise variety part well enough. We're not doing the nutrition well enough, but we then get into a sauna and then into a cold plunge because we saw it makes us live longer. And again, like, that's working around the finer edges for sure. And that's me. I feel like that was pretty good for a doctor, right? Pretty low amount of slides. Naomi, did I do it okay?
Jeremy, that was amazing. Fabulous. So thank you so much. And of course, you already started priming us for all these great questions that we got. And especially that last slide, I think there were some questions on as well. So are you ready for me to, I'm going to start with some of the big questions that came in pre-registration because we clumped a bunch of them together to kind of get some general ideas, but we'll start with some simple ones. Okay. All right. So the first question, just because you do work with the Bulls, was, are there any nutritional supplements that NBA players have before or after a game or workout to help with recovery?
Yeah, it's a good question. I will say that the trend these days has been to put less things in bodies, not from the providers recommending it, but actually from the athletes themselves. I think that trend has been a little bit based on, obviously getting a supplement and then having a banned substance in it scares a lot of people. But I think overall, there's been more of a push to be more natural in things. So we don't have as many people taking, pre-workouts or post-workouts or like slamming so much protein that they're not getting, it's like take a whole bottle of powder or anything like that. And I got to be honest, sometimes they're even deficient in things where like they're vitamin D deficient. Think about it. Basketball players are indoors all the time. And on top of that, many of them have dark complexions. And so they're perfectly set up for vitamin D deficiency. And so many of them are deficient, and we ask them to take a vitamin D supplement, and it's hard enough to sometimes even get them to take that. So I think the short answer is there really aren't a lot of supplements that they're taking at this point. And when people ask me in the office or around, should I be taking supplements? Most of the time I tell them that the time and energy they're putting into trying to do that supplement could be put into finding the foods that have those nutrients in them, and they probably could be getting the benefit of the whole food in general.
Instead, sure. All right. So in alignment with that, so I'm asking a bunch of sports specific questions because I think that's
I guess I'm a sports doctor, so
yeah, so it makes sense. So how do I have the health and physical properties of a pro athlete without being one? So are there any tips or tricks on how to have that health in the physical body?
I mean, the awful answer to this question is go back and have your mom and dad be professional athletes and have them birth you as a professional athlete. I mean, I really truly believe that the majority of the professional athletes that we work with, like a lot of it is God-given, like their bodies didn't come because they spent more hours in the gym than the rest of us. Now they work very hard, and I do not mean to diminish that at all. They take their natural gifts and bring them to the next level. But a lot of times that next level is taking them from a level that is still above most of us and then bringing it above them. So I think when people want to perform like a professional athlete, most of the time, I think the focus ends up going on quantity rather than quality. So it's kind of like they must train all the time, so I need to train more so that I can have that 8-pack abs or that body that they have, or I can jump and dunk. And I will tell you, most of my, like when my basketball players finish the season, they don't go play basketball. I mean, some of them are in love with it and go play, but most of them go do something else because they've been playing so much basketball. Also, it's good for their bodies to rest. In addition, when they like, how do I want to put this? When they do training, when they come in and they're with the strength and conditioning coaches, they do a certain amount of training, but then they have an hour or two dedicated to being with physical therapy and with athletic training and making sure that they have good flexibility and they have like monitors on where we can see their heart rate and their strain levels at all times. And we're trying to make sure that they're not overworking. So the danger here is that by trying to do what we're doing with them, we start putting sensors all over our bodies and trying to figure out where our levels are. And the vast majority of the time, the data on that is that we don't even know what that data means in most people. So
Yeah, true.
again, I think it's not a great answer. And one of my pet peeves of physician interviews is when we give these broad blanket answers that don't give helpful information. It's kind of why I made the podcast in the first place, was to have like
Right.
physicians actually give good information. But I truly do believe the question was asking me, how do I get to the level of professional athlete? And I just think that, like, I was born and I was never going to be. I pitched in college. I was a very good pitcher. I'm 6 foot, 175 pounds as a upper 30s person. Like, I was never going to be in the major leagues. Like, you go stand next to these people and you're like, oh, okay, I get it.
All right. Fair. What are some good supplements to take for training and recovery, or are there best recovery drinks or foods?
Yeah. So I think the question, there's probably a few different answers to that question. I think the last thing you just said made me think of when somebody finishes a workout, should I be consuming something for recovery? The data is all over the place on this because I think for a long time it was consume as much protein as you can right afterward. I don't think it's bad advice, but you got to be careful that you're not sucking down a ton of sugar with that too, because to make something with protein in it taste good, sometimes there's just so much sugar in it that you're also spiking your blood sugar. But anybody who's on this conversation who has taken time to like go through the educational resources on your app knows that also exercising when you're on an empty stomach and not eating afterward can have a benefit for your health too. So I'm not sure if there's a right or wrong answer to that. For a long time, when I was done with a workout, like where I actually used my muscles and I wanted to try to, like, I don't know, add strength or girth, I would have like some sort of like chocolate milk or protein. I'm not sure if it made a difference for me, to be honest. And I'm not sure I felt much different afterwards. So I think you have to find what works for you. But if you want me to reference the data on it, I would tell you it says for one person, like in one study, it says everybody should be doing this. And in another study, it just says everybody should be doing that. And I think it's got to be more individualized. I don't know if you're seeing the same thing, Naomi, but I just feel like it has to be, each individual person is going to respond differently.
Totally agree. Absolutely. Yeah.
There was a second part of that question about like supplements for recovery. The supplement industry is very poorly regulated, but when it comes to the musculoskeletal world, I feel like the one that gets the most hype these days is collagen. So I can talk about collagen briefly.
Yeah.
Collagen is makes up all of our body. We did a great episode on this. Type 1 collagen makes up like 97% of our body, and it makes up like our skin and all of the things that make us look young and then old. And so, but then type 2 collagen is in our joints, and then type 3 is more in our skin, and type 4 and 5 in smaller areas like eyes and stuff, is so on and so forth. And so when you go buy a collagen product, what you're buying is collagen peptides, because you can't absorb collagen, and collagen peptides are things like glycine and leucine, if anybody took biology class and or organic chemistry and such. And when you absorb, though, there's no way to know if that glycine and leucine and proline and all that stuff is going to become the thing you want it to become. It just goes into your body. Now, that doesn't mean it's not going to become what you don't want it to become, but there's no way to target it in any way. But there is some interesting data through some meta-analyses that say taking type 1 collagen, and interestingly enough, these were all done on fish studies, marine collagen. But if you buy most of the popular products, they're all bovine cartilage, which is our collagen, which is like cow. So I find that a little interesting too, because there's really been very little study on bovine. I just think it's easier to find because we use a lot of cows in this country, unfortunately. But the skin and aging, they can measure them with like calipers and people's there's different ways you can measure aging through actual objective measurements, and it did show actually less signs of aging by consuming it on a regular basis through these meta-analyses. Now, 98% of the people in these studies were women, so we can't apply it to men. And the response back from my co-host, Julie Bruni, at that time was great, because she was like, how does that feel? Which was reasonable.
Julie's so great.
Finally, 98% women in a study, which was good. But so I guess Hilarious. It can't really apply to men. When it comes to body, like your joints, type 2 collagen is that one. And there's some mild evidence that you could decrease osteoarthritis pain by taking type 2 collagen. But there's no evidence to decrease joint pains in general without a diagnosis of taking type 2 collagen. So I guess in theory, if you had regular type 1 collagen every single day at the doses that were in these studies, you may not see your skin age as much, but it's not going to probably help you recover all that much.
All
It's also
right.
very
So, yeah, super expensive. But not harmful. You haven't seen studies that show harm.
Yeah, zero harm. These
Yeah.
are the building blocks of us. You're just absorbing them, and you can get them through a lot of different parts of your diet. And if you're a vegetarian, it makes it seem like you have to have meat because all these collagen products come from theoretically a meat source. But there's plenty of this stuff in vegetables. Mushrooms have a ton of these things in it. And so again,
really?
there's easy ways to just Google like collagen peptides in vegetables, and there's a million foods that have them, and you do not have to eat meat to consume these.
Wow, mushrooms. That's pretty cool. Okay, so next question. What are you most excited about that's new in the world of recovery?
It's a double-edged sword, but I do think the answer is wearables to a certain extent, because I think because of wearables, and there's obviously a lot of brands out there, and I won't rep any of them more, although some are more accurate than others. From my experience, the studies have shown that primarily the more accurate ones are the Oura Ring and the Whoop. So if people are doing those things, like you want to make sure you're getting one that's getting accurate data. The Apple Watch is not very accurate for the data. It's trying to do text messages at the same time as trying to take your body data. So you just got to be a little bit careful of how much assumptions that are being made with the data to try to give you this beautiful score. But the wearables do make us more aware of what we're doing on a daily basis. And therefore, when you talk about recovery, I do think they put a measurement to the aspect of you need to be focusing more on not overstraining your body. And so I do know with those, sometimes you'll get a warning that says you overstretched yesterday, your sleep was poor, like you should be doing more of a recovery day today. And I think to get individualized responses like that is incredibly powerful. The problem is, again, at this point, that I think it's still a little bit not accurate enough for individual interpretation. And so there's still a little bit more marketing than accurate data, but I still think that that's going to be the future. As AI continues to get better and better, and we start to learn more ways to get better data, I think that that's going to be really helpful for our recovery.
Yeah, absolutely. All right. I'm going to shift to some of the live questions, then we'll come back. So there's a lot of these really great questions that people submitted already. All right, let's start with our first. Interested in hearing your thoughts regarding red light, EMF, and Normatec compression therapies. Is TENS therapy strictly pain relief, or can it aid in healing as well?
So it's a good question that wraps a bunch of things into one. So each of those probably has an answer. Red light therapy, from my experience, we had a good episode on this too. I don't mean to keep repping the podcast, but the point is like, these are things people are talking about, and we've certainly covered some of this stuff. Red light therapy has been shown to help with wrinkles. It like helps you get more definition in your firmer face and such. But I don't know much about recovery as far as exercise. I haven't seen any data on that. So I think if you shine a bunch of red light on a joint or a tendon, I don't think it's going to make much of a difference at this point. Electromagnetic stuff is interesting. I don't think there has been a lot of like electromagnetic data to say it's supportive, but like it makes me think of shockwave, and shockwave is very interesting. The data is really early on it. It's being overused. This is what happens in most medical things. Like a little bit of promise comes out, it gets completely overused and promised, and then we start to work our way back towards what it actually does. And most of the stuff is out of pocket, so it costs people a lot of money, and it's the worried well that are paying for it. But shockwave has been shown to be pretty effective with certain conditions like plantar fasciitis or certain like tendinopathy type conditions and decreasing pain. It does hurt to get it. So it's not the most fun to have shockwave therapy. And I think 5 years from now, I think shockwave will have more indications as things move along. Normatec compression therapies just look cool, but are probably not doing a whole lot and are very, very expensive. That's just really good branding. And again, Normatec's a brand. A bunch of people make these compression things. After surgery, they make ice compression units where you can put it on and it'll help with compression and ice. It feels very good. I have no problem with you doing it. No risk, but probably not worth the $1,000 that you're paying for it. TENS therapy, strictly pain relief, can add to aid in healing. Probably pain relief. I mean, where we've seen TENS be a little bit interesting is in people who have atrophy. So let's just say your quad is atrophied. So post-surgery, sometimes people have quad atrophy, or I don't know, somebody had a stroke, or frankly, you just like didn't do anything for a while. If you use TENS to activate the muscle and try to activate it at the same time, you may be able to reactivate nerve pathways that had been a little bit dormant. So there may be some role in strength training, but I don't think it helps a whole lot in healing. I don't think you're getting much healing with that.
All right. Here's a question from Tiffany. We work with female teen athletes very concerned with mobility and injury prevention in the knees. Is red light or infrared therapy contraindicated under 16 years old, especially when it can concern the growth plates?
Yeah, great question. Definitely ultrasound is contraindicated in your growth plates. Red light therapy, to my knowledge, is not contraindicated. I'd be shocked if red light therapy was making it down deep enough to get to the growth plates. It's just not making it past your dermis level. I guess don't 100% quote me on that, but I'm pretty sure that does not make it below the dermis. And then infrared therapy, I think it's the same as red light therapy. I'm not as familiar with infrared therapy, so I'm not as confident in that one. But I've seen of the red light and infrared therapy for dermal, like dermatology type things, like skin conditions, not as much for joint and muscles and tendons. And so I'd want a little bit more data before if somebody said I was going to spend a lot of time with red light and infrared therapy on a 16-year-old athlete, I'd say, well, what things are you giving up in your therapy to do those things? Because I think there's more evidence-based solutions than that. But yeah, young girls, hypermobility is a big problem. We're seeing more POTS disease that's associated with hypermobility, injury prevention with ACL preventions and things like that. This is all great stuff that I love that people are focused on.
Yeah. Oh my gosh. So great. All right. We have Adam. Lost 100 pounds in 6 months. Congratulations. I've been going viral on TikTok for that. My most common question in my comments is if fasting leads to losing muscle mass. I personally have done a DEXA scan and I believe I've not, but what are your thoughts on this?
So I'm going to interpret that as I did a DEXA scan. I believe I have not lost muscle mass, I assume is what he meant by that. And DEXA actually is it's not perfect. We don't have a perfect way of measuring our strength or our mass, but DEXA can actually do a pretty good job of looking at it overall. So, I think it's an awesome question. And I think the most important thing that when you are on a weight loss journey, if you've decided that that's right for you, is that strength exercise is still really important. And I think what we see a lot of times is that you can lose more weight if you don't do strength exercise because muscle has mass to it. And so I think so long as you are focused on at least twice a week doing a strength program in which you're trying to lift some weights in some form or fashion, I'd be surprised if the average person was probably losing a ton of muscle mass. And if somebody is losing 100 pounds because of behavioral change, which is obviously not going to happen for everybody because not everybody had 100 pounds to lose because of behavioral changes. There are people who are doing everything perfectly and stay at the weight they are, which is, we're still trying to figure out why that is. But in this situation, it may have been also you could gain muscle mass because you're doing more exercise and getting more strength exercise. So, I'm not sure I would tell people if they asked me that question directly, if it was my experience, that I wouldn't have gone on that journey because I was losing muscle mass. I would just be advocating I make sure to do strength exercise to keep up my muscle mass.
Yeah, and actually there's several meta-analyses that have looked at this because this is a constant question that comes up. And of course, it's been pretty consistent. If you exercise, intermittent fasting will help you lose more fat mass and maintain muscle and lean tissue. So that's been confirmed over and over and over again. So that's reassuring. If you don't exercise, you're going to lose muscle mass regardless of whether you're intermittent fasting or not. So it's kind of like the exercise, as Jeremy is saying, is the most important component here. And, Jeremy, one of the things I really loved about your presentation right now was explaining it's the recovery that's also important. So yes, exercise and have recovery, and you have to have nutrition in addition to fasting. So it's, you got to have all the pieces and the sleep and the connection. So all the pieces matter, but intermittent fasting with exercise will not cause you to be losing muscle mass. Your body will maintain that. All right. How useful is an ice bath for muscle recovery after strength training? We're going to get a lot of these kind of questions.
I love this question. I'm a big proponent of cold immersion. So the answer to the question is cold immersion following strength training will help recovery in terms of muscle soreness, but has been shown in studies to decrease muscle gain. So you have to decide what you're going for. Because if you're going to do a big muscle workout and you want to gain muscle mass and get stronger, you don't want to get in the cold immersion and probably need to wait, I think, around 24 hours before you cold immerse to not get in the way of that muscle buildup. In a world in which you are doing it for recovery and you don't really care what your muscle buildup is going to be and you want to do it just for get your heart rate up, you will feel less sore. Probably, and it does help with muscle recovery, among many of other things that it's been shown to potentially help with. And then there's a lot that goes into ice baths, and that could be almost a whole episode. It was an episode, as I keep saying, but there's a lot of information out there, like what temperature to do, how long to do it. You need to do it safely. It can seriously cause consequences if you're doing it poorly. There's some interesting data that says that you don't need to go below 50 degrees and you still get all the benefits that you would get if you went down to 30 and 40. And, the companies like to advertise that. But no, I'm a big fan of cold immersion. I have a plunge at my house that I do relatively frequently. I really enjoy it. It wakes me up. It's the first thing I do in the morning. It's better than a cup of coffee. And I do think that the number one thing I noticed when I made that as part of my regular routine was that my overall body soreness, like that I'm getting older, getting out of a chair feeling, was much less.
So you have a cold plunge in your house?
I have it in the backyard.
Nice. Okay.
Mm-hmm.
Awesome. All right. Very good. Jealous. Okay. Is use of a sauna helpful for recovery? Other end.
Yeah. So it's funny. I had a physician friend of mine reach out and say, hey, you guys should you should feature saunas on the show because I've seen all this compelling data. And he sent me a few people who focus on this with a YouTube clip, and I watched it. And there is some interesting, compelling data on saunas. And most of them come out of like Finland, out of the area, or the Nova Scotia area, like up in Norway and such, because they do so much sauna up there. But they're all associative data. What it means is like people who sauna seem to have less heart attacks, but you're like, there's a lot of other things that could have been associated with that. They didn't have half the group sauna and half the group not in a randomized fashion. People who sauna also tend to care more about their health. And so they may be healthier. So the long and the short of it is, just like cold immersion can be beneficial, sauna actually has been shown to be helpful with both muscle recovery, improved focus, decreased depression and anxiety, overall mobility, and it is so individualized. And so I think if somebody said, I'm going to start a sauna routine, the first thing I would say is, are you cardiac healthy? Can you be in hot temperatures? Like, I don't want you flipping into AFib because you're somebody who has that and now you're in a high temperature. But as long as you're safe to go in, I think it's reasonable to start a protocol. There's lots of different protocols out there. And then to try it for a couple months, and you got to be relatively regular with it and see if it makes a difference for you. And I think if you get 2 months into it, same with the cold immersion to a certain extent, and you haven't noticed any appreciable change in yourself, then it's not going to do anything for you. Like, it's not doing things. It's not going to make you live to 100 just because you were doing it. You have to feel some benefit from it. Also, it can be expensive. You can access them sometimes at gyms. You can get one for your house if you have the means to do that. But people will spend a lot of money on this stuff, hoping that it'll make them live forever. But no, I think, and then to combine the two questions, there's been a lot of studies that have shown actually going hot to cold. So like alternate therapy has been really beneficial. And again, the studies are not strong enough to say yes for everybody. They just aren't, but they are compelling enough to say there probably is something there. And so I think the hot to cold has something there too. That one you got to be really careful with if you have medical problems. Because the number one thing that kills people in a cold immersion is actually, I didn't mention this with cold, but the number one thing that kills people in a cold immersion is going into an arrhythmia. because it shocks them into an arrhythmia. So you just got to make sure it's the equivalent, the amount of METs. So like the amount of exertion you're giving out by going into cold immersion is the equivalent of like sprinting a 60-yard dash. It doesn't. So
Wow.
so if you wouldn't do like a 60-yard dash, you may not be able to get into a cold plunge.
Got it. Well, that is, wow, I didn't know that. That's really impressive. All right. Even more effective then. All right. Here's a question moving into the exercise component. Jim asks, how can I balance my work and workout and fast schedules as it relates to recovery?
Yeah. I mean, this is the number one thing that gets in the way of everything, right? If we didn't have work or families or anything, we would be able to do all the things we wanted to do in our lives to a certain extent. But I think it's a personal challenge I have myself too. I think the number one thing that I've come across that I think is the most beneficial for people is a concept called habit stacking, where more or less you have things that you do on a regular basis, on a weekly basis, every single day or every single week, and it's just routine. So I think a common one that comes up is brushing your teeth. Like we brush our teeth twice a day and we just don't think about it. We certainly don't be like, I didn't have time to do it tonight, I'm going to go to bed. Like we do it. And so if you wanted to add something new to your routine, you stack it with something you're already doing. And if you do that for a period of time, a couple weeks to a month, most of the time it becomes where you can't do the other thing without doing the other thing, because they feel like they're part of each other. And so in my own personal experience, what I have done is tried to stack something that was important to me. So I'll use today's Monday. Monday is my yoga Mondays. I love yoga Mondays. I wake up, I drop my kids off, and I do yoga before I come into the office. And I almost I get irritable now when I can't have my yoga in the morning. Like it's just become so routine for me. And so I think as long as you're planning out your week, most of us have a relatively routine week. There are some people who struggle with jobs that change all the time, but for the most part, we have relatively set times and shifts. And so you just try to fit in there. Where does the exercise fit? And what do I enjoy doing? So I'm looking forward to doing it. I hear that all the time too. People be like, I can't run. And I'm like, do you like to run? And they're like, I hate running. I was like, well, let's start about doing something else that you like doing. You just got to find something you enjoy doing. And then with the fasting, maybe I'll defer to you a little bit, Naomi, on this, but what I found is that, because the fasting is such a regimented schedule too, sometimes you can habit stack it with your fast. To a sense of like every time I'm going to end my fast is right around the time I could get a workout in. So I'm going to do the same thing. But, I don't know if you've given advice differently, Naomi, in terms of the fasting with the exercise.
Well, yeah. So there's lots of different data points in this space. And what I'm going to do is actually shift into these kinds of questions that have to do with fasting, exercise, aging, and things like that. Some of the pre-submitted questions, and then we'll come back out to these. But yeah, so with regards to fasting and exercise, again, the most important thing is hydration, no matter what, and exercising. Again, to Jeremy's point, recovery is important. So we have to make sure we're giving the nutrition and the fuel necessary to be able to do the exercise. But it can be, if you exercise fasted, that's okay. If you like the exercise you're doing and you can do it more regularly and in a safe way, that's going to be the most important thing. I think different eating patterns, we'll kind of get into this as we sort of explore these questions, but different eating patterns will result in different exercise routines. So let's just kind of dive into that.
You hit on something real quick that I want to point out, Naomi, that was a good point. If you're going to increase your training load and you're going to start fasting, you got to make sure that you're not necessarily cutting your caloric load a lot. Because again, you're increasing the demands on your body. So even though you've decided I'm going to eat over a less period of time, you still need to probably make sure you're getting the same amount of relative calories that compared to your exercise load. Now, some of us are eating too many calories. And if we lost some of those calories and increased our exercise, we'd probably still be fine. But you just got to pay attention to, like, with increased training and fasting, that you're not like just skipping a meal and therefore getting less calories and increasing your training. And that's how you see me with a stress fracture.
Exactly. So I think that having enough fuel is going to be so important, and particularly like the proteins. And So the question that seems to come up, we got many, many questions in the space. And this is sort of the big, broad questions are what exercise and how much? How do I know that is enough or it's too much? And how can I think about this as I age? So are there changes depending on the age or as you get older?
Yeah, it's an awesome question. And everybody is different. So I usually say the most important thing to do is to learn your body and listen to your body. If something feels off, you need to listen to it. Most of us power through because we're too busy to not. Your body's trying to communicate to you. Certainly, if you feel pain, most of us know that that's a problem. But if you're feeling shifts or if you're feeling, lightheaded, if you're noticing that for whatever reason the workout doesn't feel as good in today as it did another day, like it's okay to not do the same thing every single week and to be forgiving to yourself. I do think that sometimes we're a little hard on ourselves and I'm just as guilty of this as anybody else. Like I usually work out today and I just don't feel like I can do it and I don't want to, but I'm like, I have to. And it's like, it's okay to make that a recovery day and to be like, mentally, I just need something different today. And to use that time to do something else, whether it be meditation or, connecting with people or going for a walk that's not even for exercise. You go on a nature walk or something like that. So I think being forgiving to ourselves is really important when doing that. I'm not sure if that 100% answered the question.
Well, really, like how do you guide people who, let's say they've been very fit in the past? So I have, for example, 59-year-old female, 61-year-old
Yeah.
female, a 69-year-old male, 70-year-old male. Many of these individuals are asking, I used to exercise a lot and I had these routines. How do I do this safely? What if I have osteopenia? Like, I think safety is a big concern
Yeah.
and also not losing muscle or becoming frail. So how does how do you guide people to know how much and how often?
Yeah. Aging's a really hot topic right now because we have 80-year-olds currently wanting to play pickleball, and that's never happened before. The generation
Yeah.
before these 80-year-olds did not want to play sports. They just were surprised were 80. And this is a good thing. This is a very good thing, but we're all learning
Awesome.
together.
Yeah.
We're learning together how to manage that.
Yeah.
As we age, we atrophy much quicker. We lose muscle mass a lot faster. We recover a lot slower. Our collagen is a lot stiffer. It is not as pliable. We all know what it feels like to get out of a chair and be like, it's just not what it used to be. And so when you talk about exercising as you're aging, there's the how do I know if I'm safe cardiac, which is probably the most important. And the easiest thing to do in that situation, in my opinion, is if you're not sure if you're safe enough to do something, to check with your physician. And a lot of times you can even just get a treadmill stress test where they put you on a treadmill and they have you run or walk or whatever you can do to get your heart rate up. They look at you in an EKG and they tell you whether you're having any abnormalities. And that's a simple thing to do. That is a really, really good way of finding out if you're able to do that. You can also, if you're higher level than that, you can find an exercise physiologist to do VO2 max on you. And even in that regard, you can have the EKG and all that part of it too, so you can get your fitness level. So there's ways to get testing. And I think sometimes people think that they can only come to doctors when they're sick or unwell. And a lot of times there are things that we can do to try to help with these things. Even sometimes when they're not covered by insurance, you can still get them done the same way if you go to a local clinic who is not a physician and you pay out of pocket for it. So I think that's a good way. If you're outside of the cardiac, so now you're talking about like osteopenia and the muscles and the bones. The muscles themselves atrophy like crazy, and postmenopausal women even more so. And so I say that everybody over the age of 60, this is everybody in general, but I tend to notice around 50 or 60, we stop lifting weights. We stop doing, and I think part of it's because it's hard. Part of it's because most of the people our age aren't doing it. Part of it is access. Part of it is the goals change. But ultimately, like if you're not lifting anything and then I'll hear like I tried to lift something in my closet and I like got hurt and like, why did it happen? I'm like, well, when's the last time you lifted something that heavy above your head? And it's just not happening. So you need to be able to do functional movements. So even if you're taking a 5-pound weight and lifting it 10 times over your head 3 times for sets, I mean, that's going to help maintain the musculature you already have. And then finally, to talk about the bones like impact. So if you have osteopenia, the best thing you can do is impact exercise. So you need to be walking. Like if you're in a pool the whole time, your bones are going to get weaker. So you got to be active. there's almost like nothing that comes into my office outside of a fracture, a stress fracture, or something that's impending fracture that I tell people stop moving. Like you need to be moving.
Yeah, for sure. Absolutely. Do you have any recommended resources with regards to how to identify like exercises or stretches for people?
Yeah, so there are some reputable people on the internet that do a good job of this. Some of them are free, some of them are behind a paywall. But many physical therapists and personal trainers will have social media accounts, and the reputable ones do a really good job of putting out good information. The one that I would rep the most, or the one I think does a really good job, is the Prehab guys. So that's rehab with a P before it. And they have an application, and you can download it and pay subscription if you want, but their social media is great. They have both personal training, but also physical therapy. So if you have a knee pain problem, they have a program that you could just do on your own. There's lots of other great programs that do that. For the most part, I'm trying to think if there's any others that I send people to regularly. Like when people come to see me in the office and I'm going to send them a home exercise program to work on, I subscribe to those guys, and I make my own programs using their exercises to do it. But the one thing I would also let people know, the bar is not too high to do this, is a lot of places have walk-in ability to physical therapy, or you can see your doctor and get a prescription, and you can go do one visit at a physical therapist and get an evaluation and have them make a home exercise program for you. So you don't have to go the whole time. You can have somebody come in and be like, I'm really wanting to strengthen my glutes and my quads, and I want my hamstrings to stop being so sore. Can you make a home exercise program for me? And somebody will make that for you. And again, that would be covered by insurance, which is always fun.
Yeah, it's always so great. All right. And then with regards to, do you make any specific recommendations regarding fasting and workout timing and or electrolytes?
Ooh, electrolytes is a big one, separate of what you just said, because it's just very popular right now in all the drinks.
Feel free to dive into that one. Yeah.
I don't make a lot of specific recommendations for fasting and exercise. I think it goes back to the earlier question of like, how do we fit it in with work and with our lives? I think one of the things that I dislike about influencers and people who tell us all the things that we could be doing to live longer is that many of them are doing things in a way that none of us can feasibly do or do in our regular lives. And we feel like failures for that. We feel like we're not going to live long enough because we can't do it the way they do it. And I think that is wrong, because the data that they're referencing is weak. And so it's prescriptive, and it leads to a lot of guilt and issues. So no, I think you need to set up your fasting and your exercise in a way that works best for you and gives you the best chance for success, mostly long-term. It needs to be something that 6 months from now, you say, I could still be doing that. Not something that somebody else could be doing. Electrolytes are a huge thing. One of the things that gets brought up a lot in our podcast is marketing versus science. Electrolytes are mostly marketing. We get all our electrolytes that we need for the most part. When you go buy an electrolyte beverage, you're not going to be healthier than anybody else. So the amount of time that we end up having to physically give people electrolytes because they're low on it is incredibly rare. Water is the best thing you can be drinking for anything. You'd have to drink an asinine amount of water to put yourself in a position of having a health problem from drinking too much water and not getting electrolytes. And there is medical conditions that are for that, but you literally have to have like a medical, like a hypothalamus problem, a pituitary problem to get there. So I'm not a big fan of electrolytes. I think it's a way to take my product and say, go buy that sparkling soda because we have the electrolytes in it, or here's this easy packet to put into my water, and so it doesn't taste like water anymore, and I'm getting electrolytes, so it's healthier for me. But in reality, most of the time, there's either stevia or sugar, or they'll put caffeine in it. And by the way, the caffeine makes you feel really good. So a lot of times there's caffeine hidden in all those products.
Sure. Okay. So, and then there were some questions that came in about safety of exercising and fasting. And I just want to point out, as long as you're getting good nutrition, staying hydrated and getting your rest and doing all the other things, You can work out whether you're fasted or not. The studies are pretty clear. It's fine. Your body knows what to do. If you're on medications, that might be a different scenario. If you're on certain medications that cause you to have lower blood sugars, for example, because maybe you have type 2 diabetes, then there might be some other rules around that. But pretty much you can work out fasted as long as you're other rest of the time getting your protein, getting your hydration, and getting your adequate rest. So those are important. We are like,
talk about
oh my
hydration
God.
for one second, just like
Yeah.
how to measure that, because I think there's two primary ways to measure your hydration status. One is with pee. Most of us know that when our urine color changes, but there are professional teams that I've been at where it actually was the picture over the urinal or over the stall that said your color should be this, your pee should be this color. But another thing is the first vital sign that changes when you're dehydrated is your heart rate. So if you notice that your resting heart rate is higher than it usually is, you may be in a dehydrated status. So that's where those wearables maybe come into play, where you can have something that measures your heart rate. If you're going to start fasting and you want to keep exercising, just monitor your heart rate over that period of time and compare it to what it was before, and just make sure there's no big abnormalities there.
That is such a good point. So a lot of people who come to my clinic end up, on a weight loss journey. And we see that sometimes, whether it's from taking the injectable medications or dietary changes or whatever they're doing for weight loss, their heart rate can go up because they're not drinking enough fluid. So you're right. That is such a great way. And I also tell people, look at the color of your urine. It's so useful to know.
Mm-hmm.
So yeah, absolutely. All right. So we've got 3 minutes basically until the end of this time, and we can do a little after hours if you'd be up for it, Jeremy.
Sure.
Otherwise, I'm going to just run through and make sure everybody knows that fasting is not for everybody. And we did not actually talk about this earlier, but I want to make sure to just kind of go through. Fasting is not appropriate for everyone. It's not recommended for individuals who should not be using fasting for weight. Special consideration. So we did have some questions. For example, if you're breastfeeding or pregnant, no fasting for you. Under 18 years old, no fasting. Current eating disorder or history of an eating disorder, no fasting. BMI less than 18.5, no fasting. If you have an emergent illness, disease, or condition in which you're actively seeking medical treatment or prescription medications, again, we would recommend not fasting at this time. And if you're not sure if fasting is safe for you, you can always ask your physician or healthcare professional. And again, here are our resources and our support also. So for those of you who have the Zero app, you can see that we've got lots of educational content as well as challenges for everybody. And you can also find us on Instagram and YouTube. This will be posted on YouTube. So anybody who is asking, is this recorded? That is available. This is our Zero Live for June, and we are going to be trying something new moving forward, which will be a surprise that we're going to have where we'll have special guests. And Jeremy, are you up for staying a little bit to answer some more questions for after hours?
I'm totally up for it. And I was just looking at some of these starred ones, and I feel like I could rapid fire through a bunch of them if you want me to.
Okay. So are you able to click on them, put them on, or would you like me to just pop them up and then you'll answer?
What happens if I click? I don't think I have the clicking ability.
Okay. All right. So this is, so again, we're so grateful that you joined us today. And if you would like to stay for further questions, especially if you're on already and you've got your questions here in the chat, we're going to go through and Jeremy is going to answer through all of these questions right here. So stick around. Otherwise, those of you who joined us, thank you so much. It's been a pleasure, and we're so grateful for your enthusiasm. All right.
I will. I can also take questions. Socials, Jeremy Alland, MD, Instagram. You can reach out through that. And then again, our podcast, Your Doctor Friends Podcast.com. So other ways if people have questions later on.
Great. Awesome. Okay. And what I'll also do is I'm going to put your picture up so that people can then get your QR code.
Sweet.
There. Okay. All right. Let's go. Here's our first question.
All right. Good exercises for a knee replacement surgery patients. The most important thing after knee surgery, knee replacement surgery, is to get your motion back. So make sure you're doing bending and straightening. You're going to be with physical therapy for this part, so we don't have to focus as much on that. Long-term quad and butt strength. I want to see some strong butts. Like your butt should have real nice definition in it. The most common exercise that gets done for this is clamshells, where you lie on your side and you kind of open up one leg. It's a great exercise, but frequently done with poor form. So just make sure you have somebody teaching you how to do it, because otherwise it can cause some discomfort. What I usually tell people is, those little rubber bands that you can buy that you can put around your legs. They're not very expensive. You can buy some fancier ones that don't pull your hairs if you want to. But I tell people to put those on. And even if you just have a bunch of chores to do around the house, you just walk with those bands on. Don't fall.
Wow.
But ultimately, like walking forward, doing monster walks with those, walking backwards with those, doing side walks with those, standing at a leg, lifting your leg away from each other, you're hitting almost every muscle group that you need in your lower legs. And you didn't even have to stop your day to a certain extent. Again, with the fall risk thing being there.
Fabulous. Thank you.
We kind of touched on collagen before. Yep. I think data's still out. I will tell people when they come to me for joint pain, if they have knee arthritis and they're looking for a supplement, glucosamine chondroitin has the most evidence behind it. It is much less expensive and much more accessible. But beyond that, type 2 collagen has some mild data behind it, and it's not unreasonable. You have to take I forget the grams. There's a good meta-analysis online. If you want me to send it to you, just reach out to me and I'll send it to you. But I don't think it's unreasonable. It's perfectly safe. I've tried collagen for a month to see if it would do anything. You guys haven't seen me before. I don't look that much younger, I don't think. So I'm not sure, I guess is what I'm trying to say.
I think you do look like you're getting younger, Jeremy.
I mean, you have to balance that out with a 7-year-old and a 4-year-old. So it may have just been that I was not balancing the
Great.
Favorite donut shop and pizza place. Donut shop, Do Right Donuts, hands down. Favorite pizza place. Old school, I do love a good Lou Malnati's. So that would be kind of like my deep dish choice. Pequod's is incredible if you go to Pequod's. Those would be my two favorites.
Sweet.
Ideally, I would like to be able to least moderate intensity exercise. How do I do this every day? Oh, okay. Yeah, so this is a good question, because what this reminds me of is as human beings, when we decide we're going to do something, we rarely do it half. We decide we're going to do it all at once. And marketers and businesses know that, and so they prey on that. And so when you talk about these boutique gyms where you can buy a membership, and the membership is like you can go as many times as you want. Well, we're going to go as many times as we can, because one, that's good for us. We need to exercise, but we also want that per class thing to go down, get our most value. Like, it just plays into all the weaknesses. And then the worst part is most of the time the classes are all the same, and not the same exactly, but they work the same muscle groups. And so the overuse injuries come like crazy. So the answer to this question directly is periodization is the word. So if you Google periodization and how do I do that in my exercise, that's what you're looking for. You're trying to figure out ways to engage different muscle groups on different days. This is the old school, like back and legs on one day and tries and chest on another day. I mean, that's old school mentality, but more so like yoga one day, high intensity exercise the next day, swimming the third day, back to my high intensity the next day. So you can do moderate intensity exercise, but also make sure that you're getting different muscle groups worked. Also remember, zone 2 exercise, and I'm pretty sure that Zero does a good job of telling you this, is actually very effective for fat burning and overall health. Zone 2 can happen at yoga. It does not, like, zone 2 is not the hardest thing to get to. We're talking about relatively lower heart rates. Zone 5, which is probably everybody needs to be getting probably to zone 5 a couple times a week. But it's not for very long. We're talking about just a few minutes here and there. So to have to go to cardio to get our heart rate up, to feel like we got that sweat, just make sure that that's not what you're doing every single day. Like that's a couple times a week thing.
Great. Good.
How important is stretching? Dynamic warm-ups, meaning moving while you're warming up before the activity, is far more important than after the activity, sitting down and touching your toes. And I think the whole after you exercise stretching has been overemphasized, and the lack of warm-up has been de-emphasized. So I think stretching is actually not as important. I think dynamic warm-up, there's good ones online. The FIFA 11 was created to prevent ACL injuries in young athletes, but is actually very applicable. I'm a big golfer. I tell you, every golfer I see, all they do is they go to the driving range, they whack a few, and they get up to the first tee. And I'm like, you wonder why you're getting injured. It's just not that, like, that's not what the professionals do. And they're like, well, I'm not a professional. I'm like, how many days a week are you golfing? And they're like, 5. I'm like, you're golfing more than the professional. Congratulations. So again, you just have to be making sure you take care of your body. That does not mean don't stretch at all. I do a few stretches every night before I go to bed because I have some weak areas in terms of like tight hamstrings and a side, and it just makes me feel better. In addition, things like yoga, and I've brought that up a lot, they involve stretching. So sometimes strength and stretching at the same time. So I think that answered that.
Yeah, that was great.
Does dosing essential amino acids result in any collagen creation at all? We don't know, is the best answer, because the only way to know this is to tag them with like radioactive tags and then follow them to where they go with radioactive testing. And I just don't think that that's really been done. And maybe it has, and I'm not aware of it. The answer to your question is I'm sure it does, but there's some really interesting work by Jill Cook out of Australia, Melbourne, Australia, looking at tendons. And we have her coming up later on, I think next month, maybe on the show, but her tendon work is really interesting to show that once we hit peak collagen in our tendons at like age 16 or 17, and they don't change after that. And we can't get new collagen in them, and we can't build them up anymore. And once we have damage in them, we can't repair it ever, even though with all the things that we say that we possibly can. And I don't know if everything there is 100% some of that may be worked on over time, but it's very interesting because also I'm seeing a lot of 14-year-olds in the office with damaged tendons, which means that they're damaging their tendons before they even get to peak collagen tendons, which is scary because they never got a good tendon. So think about that with your children and how much sports you're putting them through and how many things they're doing, because that's scary. Peak bone density is around like 25 or 26. We just start deteriorating after that with our bones. So you have to make sure that you're getting enough nutrition and making sure you're getting the vitamins you need and making sure you're doing all the things to get your bones healthy and not breaking them down too much before 26, because otherwise, if you never hit peak bone density, you're never going to have peak bone density. They got more than they bargained for on that one, I guess. Is the knees over toes guy. Yes, I hear about this guy all the time. He is a perfect example of what I talked about earlier, in which what he is doing is not wrong, but the way that he tells us we need to be doing it is just not attainable for any of us. Because he's asking us to get to a level in which he was able to go knees over toes and then dunk a basketball. And he asks a lot of other people who can't do that to do that. And it's just not going to happen. The best analog I have for this is I see young dancers who learn ballet, and their ballet teacher says that their turnout has to be perfectly 180. And I ask them to show me how they do that. They turn their foot and then they try to rotate their hip with it because they can't physically do that. Their anatomy was not made to do that, but it has to look like that. So in a way, what he is really emphasizing is trying to get as much ankle mobility as possible in the front of your ankle. And I do think a lot of us lack ankle mobility, and that is not wrong in any form or fashion. It's just to the extreme with him, and it just doesn't have to be to the extreme. So it's yes and no to a certain extent. How do I get my shin splints to go away when running? Stop running. That's a bad answer. Shin splints are the earliest sign of stress injury. Basically, your musculature along the front tibia is pulling away from the bone because you're stressing it too much. The factors that go into that are how much you're running, how much you're recovering, meaning how much you're resting in between, your biomechanics, meaning how you're actually running, and then overall probably some genetic stuff that we don't know 100%. You can either decrease your running, you can, with increasing your recovery, you can take a period of time off your running until the symptoms completely go away and then gradually increase your running back. Don't go back 100% right away. A lot of times that does the trick. There are specific exercises for the anterior shin, like the anterior tibialis, that really try to strengthen that can help with shin splints. So seeing a local physical therapist can help. Getting a running analysis from a really reputable place. I know our institution has a 3D motion analysis where we put you on a treadmill for a couple $100. It turns you into a skeleton and tells you all the things you're doing wrong. That can be really helpful too. So hopefully that was some high yield information for that.
Yeah, absolutely. I was just looking, there's another question on running, so I'll just pop that up here.
All right. Real quick, if you do actually have shin splints, it is reasonable also to see a doctor. I probably should say that because one, you want to make sure it's actually shin splints. And if it isn't going away, sometimes it's not shin splints. And you don't want to find out you had something else or some sort of tumor or whatever. I don't want to scare you. But my point is like, if it's not going away, have somebody who does this for a living look at you. And if they say shin splints, then go back to them, make my shin splints go away. What supplements do you recommend to postmenopausal women with hip pain when running? Postmenopause is such a hot research topic right now because it should be, and it hasn't been for a very long time. And so we're all learning together here. And I will say I am not the world's expert in it. There are some good people doing work on this. Wright, Dr. Wright. What's her first name? I almost said Vanna White. I can't forget her first name. But she's out in DC. She's an orthopedist. I think even her tag is something like menopause orthopedics or something. But she does a really good job. I'm talking a lot about this. In terms of supplements, the vast majority of supplements are not necessary. We are supplementing because we are theoretically deficient in something. And one of the things that really grinds my gears, especially about some of these people who have very famous podcasts, they advertise these supplement companies and say that we need to have a baseline level of supplementation. They will say that flat out. We all have to have baseline levels of supplements. And it is not accurate. It makes it seem like the only reason we're living longer is because we found supplements and cavemen didn't have them. It's just not true. Postmenopausal women need to be making sure that they are getting appropriate amounts of vitamin D exposure. The number one place to get that absorbed and to use it is the sun. Wear sunscreen, but just go out in the sun. It's free. And it actually does a really good job. In addition, the exercise itself while running is not damaging your joints. The number one thing I hear from people who are confused about this is if I run, I'm destroying my joints. And we don't have data on that. There's actually some data that says running actually improves your joints. So it's mixed on that. And so when people come in and they say, my joint hurts, am I causing damage? I say, no, you're causing pain. It hurts. So we need to look for why the pain is happening and try to work through that. So if you are a postmenopausal woman having hip pain with running, seeing me in the office, I'm trying to figure out ways that we can work on biomechanics and trying to figure out your running form. Most people have too low of a cadence, meaning that their foot hits the ground 160 times instead of 180 times a minute. And because of that, they're too much impact. They're out in front of their body. There's so many things that we can change. I just don't think supplements are the answer here. And I would recommend 0 supplements in this situation.
Wait, so you just said run. So slow running is the cadence might be causing that hip pain?
Yeah. So one of the things that is misunderstood about running is that when people run faster, they think that they're striding longer, and they're not. Their cadence remains the same, but they're able to pick their feet up and put it down faster. And so most people should be running around 180, 175 to 185 beats per minute. And if you ask somebody to pick up their pace, they usually go down to about 160. And what that means is that they're basically galloping. And so then their knee starts to hurt or their back starts to hurt or whatever. So you can almost fix a lot of problems just by changing your cadence.
That's awesome. All right. 4 more.
What do you advise as far as fasting and weightlifting? I have no problem swimming or walking, but I find I can't really get a good lifting workout without eating something first. So I think this is a perfect example of an individualized question in which if there's no way that you can do a strength workout during your fasts without having side effects, I think you need to figure out, I think you just need to eat and lift. Yeah. And maybe the fasting expert who's sitting next to me in this interview can weigh in on that. But I think the lifting is too important, and it's only going to be probably 2 days a week. And I would just make sure it's good calories and things that are whole foods and probably something that allows you to function. But I just think that the black and white fasting of this is probably causing you more harm than good.
Totally agree. Couldn't say it better. All right.
How would you navigate fasting, nutrition, and exercise while working night shift where sleeping during the day may be more? Yeah, night shift is always challenging, especially with our circadian rhythms. I will defer the fasting to the fasting expert and maybe the nutrition to the nutrition expert. But the exercise component of it, I think you probably need to figure out if you're a night shift worker that comes home and sleeps right away versus somebody who comes home and can't sleep right away. Because I do think that there's a world in a night shift worker who comes home and can't fall asleep right away, that may be a good time to get a workout and then to take a cool down and then take a hot shower. And then the hot shower before bed has been shown actually to be really helpful for restorative sleep. And then to make sure you're doing all the right stuff with sleep, dark room, make sure, sleep mask can be helpful, colder room, all the good sleep hygiene. The alternative would be somebody who gets home and sleeps right away. At that case, I would say you're probably waking up and then you have to decide how you're doing your fasting. It wouldn't be unreasonable to wake up, do something to kind of get your body moving a little bit, and then actually do your workout right away. I don't think there's anything wrong with that. I do think it's hard to work out right after you wake up sometimes, but it's certainly reasonable. I don't think there's a right answer, maybe is the best way to say this. I think it's whatever feels good for your body.
I agree. And the hardest part is trying to figure out that fasting window when you've got a dysregulated cycle, or if it's not the same throughout. So you might have days that you don't work night shift and then your schedule might be a little bit different. I always recommend find that longest time period that you go without food. So that might be while you're working night shift, or it could be that you eat during your night shift, but whatever your longest period is, and use that as your fasting window. So if you have a 12-hour period where you don't eat and it's daylight hours, that's fine, but just give your body some kind of permission to recover and heal for, some quiet time for your gut. And otherwise, you don't have to worry about it so much. You can just make that work that way. And then we have,
can you run with arthritis in the knees? It hurts in the knee. The answer to the first question is yes. I have lots of patients who have arthritis, and I have a lot of them who run. I play basketball every Sunday. I play with somebody I know for a fact has bone-on-bone arthritis in his hips, and he plays better than me and is faster and stronger. Not to say that I'm the bar for people, but the point is like, yes, you can do it. I like to tell people arthritis doesn't have to hurt. If everybody who had arthritis had pain, we wouldn't have enough doctors to see everybody. The process of getting arthritis is a painless process. It's just stiffness usually that's associated with it. The pain with arthritis comes later or is associated with certain activities or the way that we're doing things. And so if this person says it hurts in my knee when I run, I have arthritis, I would say we need to try to you shouldn't be doing something that hurts. You're not going to do that long term. And you're not getting benefits of running that you can't get doing other things that don't hurt you. And you're much more likely to stick with something that doesn't hurt. But there probably are ways that we can work through either physical therapy, certain mechanics while you're running. You may be somebody who has arthritis on the inner part of your knee, and there's a special brace called an unloader brace that tries to take the pressure off the inner part of your knee and move it to the outer part of your knee. And when you wear that brace, you may notice less pain and you can run. So there's lots of ways we can do it. But sure, I love arthritis patients can definitely run.
This is so awesome. Jeremy, I'm so grateful for your time and for these after hours and all these questions. I think we talked about some of these other questions already earlier, like cryotherapy and so on. So we won't keep going there.
I can briefly talk about cryotherapy just because cryotherapy is different than cold immersion. Cryotherapy is usually, again, marketing. So basically it's somebody who can open a spa that you can walk into and stand inside something and it gets cold and they tell you that you're recovering. And they're probably not wrong, but cryo actually has no research on it at all, zero. And cold immersion, which is what they're trying to use the data to capitalize on, is much less expensive and accessible. Most of us can find a cold body of water around us. And frankly, the temperature that comes out of your bathtub is probably good enough. So I don't recommend cryo spas to anybody.
Awesome. Me too. Okay. Then we'll do the last question here.
When practicing a 4-hour feeding window that ends around 6 hours before, this feels like a word problem. When practicing a 4-hour feeding window that ends around 6 hours before bedtime, I find that I wake in the middle of the night with headaches. Do you have any comments on liquid IV? I don't know what LMNT is. Zip Fizz or electrolyte versus vitamin D. Yeah, so supplement question. It's a difficult question to answer because obviously you'd want to make sure that this is not a medical problem. This is going to take some trial and error. If the only thing that causes you to get this headache is the 4-hour feeding 6 hours before bed, then make a change and see if that goes away. And if it goes away, then maybe that's just not for you. I don't want you, we have a saying in medicine, don't treat a symptom with another treatment, or don't treat a side effect with another treatment.
Yep.
If you're getting a side effect, you remove the thing that was causing the side effect in the first place. In terms of the things that you're asking for comments on, again, things like these brands that you've brought up, it's all marketing. It's just marketing. They're not, there's nothing special in them. And I don't think that they would prevent you from having headaches. Vice versa, the amount of times I'm in a group and somebody comes up and they say, I do this thing, I drink it every time afterward, I do this thing, and I don't get any symptoms that I used to get. Like, how can you explain that if it doesn't work? And I'd say, well, maybe it's working for you. Like I'm not trying to throw shade on these companies or anything like that, or say that this is all bogus or whatever. There may be a placebo effect to it, but if it works for you and it's a safe product, we're all about it. So the vast majority of these are probably not going to give you a lot of side effects. They're not going to cause a lot of problems. And therefore, if it helps you, I'm all for it. Just make sure that there's not caffeine in it. Most of these things that advertise themselves as like that type of replacement stuff, they have caffeine. So that can be a problem. And then the other thing is to make sure that they are third-party tested. So the IV probably ones aren't, but like the supplements, if they're not third-party tested, they may not even have what they have in there. They're not regulated by the FDA. I almost won't buy anything that doesn't say NSF certification on it, because that's the highest level. That's what like Olympics use. And if a company's not willing to pay for NSF, I'm just not sure they're willing to pay for the highest quality of stuff that's going to go into my body. It's just my feeling on it.
Totally agree. I think one of the things that stands out here is sometimes we'll hear about headaches in the middle of the night related to dehydration. And so if somebody is doing a 4-hour eating window and it ends 6 hours before bedtime and you're basically dry fasting during that time, maybe that's not the right thing for you also. So sometimes it is a hydration issue, and agree with, a lot of the marketing about some of these supplements. Eat real food, drink good, clean water. Your body's gonna be able to do a lot. So sometimes you might try supplements, but we don't really advise that.
Yeah, these I feel like apps like Zero and a lot of other things, these in my professional opinion, I think these are meant to be guidelines. They're not meant to be rules. And so you start with the guideline and you see if it works for you, and then you adjust it to fit something that works for you. And if 16.8 is what all the evidence says is really great, and you can only get away with 15.9, I just don't really know if we have anything to say that all of a sudden you're not getting the benefit that the other people are getting. Like, that's the best you could do, and it's probably better than you were doing before. So it's just we live in this world of like very black and white and very extremes. Like, if you're not doing it all the way, you're not getting any of the benefits, and that's what the social media will make you believe. And it's just not true. There are shades of gray here, and you just do the best you can, and you're gonna be healthy. And frankly, just have friends and connection and human experiences, and you'll live longer than everybody. Just go those blue zones that always get advertised. The thing that always gets overlooked in those blue zones is that everybody there is a community, and they're all with each other and having friends and family and time together. And we think it's because it's what they're eating, and maybe it's part of it, but like, find some people you love and hang out with them.
I love that. Thank you so much, Jeremy. I'm super, super grateful for you staying for after hours. There will be tons of questions. Remind me again, and the audience, how they can get a hold of you.
Yeah. So I'm on social, although I did take a social break, but I'm kind of back on it. But it's Jeremy Alland MD at Instagram.
Oh, there it is.
And actually, thank you, Yasser, for putting that up. And then our website for our podcast is yourdoctorfriendspodcast.com. If you go there, there's a comment or like a contact us. So that goes to us. There's also a little tab on the side that's kind of fun. It's leave a voicemail. So if you have a question, you can leave it there. I can't promise we can get back to you that way, but we also take a lot of it, requests for show topics. So, listener questions make some of the best show topics. So please, we're always looking for things to research. And if you think of it for us, it makes it so much easier.
That's super awesome. Thank you so much for your time.